Welcome to the CCRN Mastery, the ultimate study guide for adult critical care nurses. Whether you're striving to elevate your nursing expertise, expand your career opportunities, or achieve your CCRN certification, you've come to the right place. This video is designed to guide you through the core concepts of critical care nursing, offering real-world scenarios, practical strategies, and key insights to help you excel. After each chapter, you'll find a dedicated Q&A session to reinforce your learning. For comprehensive preparation, check the description for access to the Audible version, the free Ultimate Exam Prep Guide, or the Amazon link for the book. Don't forget to like and subscribe for more updates and practice content. Now, let's begin this journey towards CCRN success with your instructor.
Question number 1. Which of the following conditions is characterized by a sudden onset of dyspnea, tachypnea, and hypoxemia, typically following a traumatic event or surgery? A. Pneumothorax. B. Pulmonary embolism. C. Acute respiratory distress syndrome, ARDS. Or D. Chronic obstructive pulmonary disease, COPD exacerbation. The answer is C. Acute respiratory distress syndrome, ARDS. Number 2. In managing a patient with ARDS, which ventilatory strategy is recommended to minimize lung injury? A. High tidal volumes. B. Low tidal volumes. C. High-frequency ventilation. Or D. Prolonged inspiratory phase ventilation. The answer is B. Low tidal volumes. 3. Which clinical sign is indicative of a tension pneumothorax? A. Tracheal deviation away from the affected side. B. Decreased breath sounds on the affected side. C. Sudden onset of unilateral chest pain. Or D. All of the above. The answer is D. All of the above. Number 4. What is the primary goal in the management of a patient with COPD exacerbation? A. Maximizing oxygen delivery. B. Minimizing airway resistance. C. Increasing sedation. Or D. Reducing carbon dioxide levels. The answer is B. Minimizing airway resistance. Number 5. A patient with pulmonary edema and heart failure should receive which of the following as an initial treatment? A. High-dose corticosteroids. B. Non-invasive positive pressure ventilation, NIPPV. C. Immediate intubation and mechanical ventilation. Or D. Diuretics and oxygen therapy. The answer is D. Diuretics and oxygen therapy. Number 6. What is the first-line treatment for a patient presenting with an acute asthma exacerbation in critical care? A. Intravenous corticosteroids. B. Beta-agonist nebulization. C. Anticholinergic nebulization. D. Magnesium sulfate infusion. The answer is B. Beta-agonist nebulization. Number 7. When considering lung protective strategies in mechanical ventilation, what is the ideal PEEP level to avoid barotrauma but ensure adequate oxygenation? A. As low as possible. B. 5 to 10 centimeters H2O. C. 10 to 15 centimeters H2O. Or D. The highest possible level. The answer is B. 5 to 10 centimeters H2O. Number 8. Which diagnostic tool is the most effective for identifying the cause of a pleural effusion? A. Chest X-ray. B. Thoracentesis. C. Bronchoscopy. D. CT scan. The answer is B. Thoracentesis. Number 9. In a patient with suspected ventilator-associated pneumonia, VAP, which of the following is a key management strategy? A. Immediate discontinuation of mechanical ventilation. B. Administration of broad-spectrum antibiotics. C. Performing daily chest physiotherapy. Or D. Increasing sedation to reduce agitation. The answer is B, administration of broad-spectrum antibiotics. Number 10. Which statement is true regarding the management of a patient with a flail chest? A. The primary goal is to restrict chest wall movement to promote healing. B. Positive pressure ventilation may be detrimental and should be avoided. C. Adequate pain control and ensuring proper ventilation are key management strategies. Or D. Surgery is always indicated to repair the multiple rib fractures. The answer is C. Adequate pain control and ensuring proper ventilation are key management strategies. Number 11. What is the most common cause of pulmonary embolism, PE? A. Atrial fibrillation. B. Deep vein thrombosis, DVT. C. Pneumonia. Or D. Chronic heart failure. The answer is B. Deep vein thrombosis, DVT. 12. Which medication is considered first-line therapy for the treatment of a patient with a confirmed pulmonary embolism? A. Beta blockers. B. Anticoagulants. C. Diuretics. Or D. Antibiotics. The answer is B. Anticoagulants. 13. For patients with severe COPD, which of the following interventions has been shown to improve survival? A. Long-term oxygen therapy. B. High-dose inhaled corticosteroids. C. Frequent use of antibiotics. D. Continuous nebulized beta agonists. The answer is A. Long-term oxygen therapy. Number 14. What is the hallmark clinical feature of a patient experiencing attention pneumothorax? A. Hemoptysis. B. Hyperresonance on percussion. C. Bradycardia. Or D. Jugular venous distension. The answer is D. Jugular venous distension. 15. In the context of pulmonary management, what does PEEP stand for and what is its purpose? A. Positive end expiratory pressure to prevent alveolar collapse. B. Pulmonary edema excretion pressure to remove fluid from the lungs. C. Post-exertion elevation of pressure to measure lung recovery. Or D. Permissive expiry pause to allow for better gas exchange. The answer is A. Positive end expiratory pressure to prevent alveolar collapse. 16. Which imaging modality is most specific for diagnosing a pulmonary embolism? A. Ventilation perfusion, VQ scan. B. Chest X-ray. C. Computed tomography pulmonary angiography, CTPA. Or D. Ultrasound of the chest. The answer is C. Computed tomography pulmonary angiography, CTPA. 17. In managing a patient with an acute exacerbation of asthma, what is the purpose of administering systemic corticosteroids? A. To immediately relieve airway constriction. B. To reduce airway inflammation. C. To prevent infection. Or D. To stimulate mucus production. The answer is B. To reduce airway inflammation. 18. A patient with a pneumothorax is likely to exhibit which of the following symptoms? A. Bradypnea. B. Bilateral wheezing. C. Sudden chest pain and shortness of breath. Or D. Fevers and chills. The answer is C. Sudden chest pain and shortness of breath. 19. What is the initial management strategy for a patient presenting with hypoxemic respiratory failure? A. High-flow nasal cannula or non-invasive ventilation. B. Immediate tracheostomy. C. Intravenous fluid bolus. Or D. Supine positioning. The answer is A. High-flow nasal cannula or non-invasive ventilation. 20. In a patient with a flail chest, what is the most common complication that needs to be monitored and managed? A. Pulmonary contusion. B. Pneumonia. C. Sepsis. D. Cardiac tamponade. The answer is A. pulmonary contusion. 21. Identify the primary mechanism of injury in barotrauma related to mechanical ventilation. A. Oxygen toxicity. B. Excessive PEEP causing alveolar rupture. C. Fluid overload. Or D. Ventilator-assisted pneumonia. The answer is B. Excessive PEEP causing alveolar rupture. 22. Which of the following is a common early sign of acute respiratory distress syndrome, ARDS? A. Cyanosis. B. Bilateral infiltrates on chest X-ray. C. Hypercapnia. Or D. Pleural effusion. The answer is B. Bilateral infiltrates on chest X-ray. 23. In the management of a patient with chronic bronchitis, what is the primary focus of therapy? A. Increasing exercise tolerance. B. Reducing airway inflammation. C. Enhancing mucociliary clearance. D. Restricting fluid intake. The answer is C. Enhancing mucociliary clearance. Number 24. What is the most effective method to confirm the placement of an endotracheal tube in a critically ill patient? A. Auscultation of breath sounds. B. Observation of chest rise. C. Capnography. Or D. Bronchoscopy. The answer is C. Capnography. 25. Which of the non-pharmacological interventions is recommended for managing patients with ARDS? A. Prone positioning. B. High-frequency oscillatory ventilation. C. Unilateral lung ventilation. D. Pulmonary artery catheterization. The answer is A. Prone positioning. 26. In a patient with pulmonary hypertension, which symptom is most commonly observed? A. Hemoptysis. B. Right ventricular hypertrophy. C. Dyspnea on exertion. Or D. Frequent pneumonias. The answer is C. Dyspnea on exertion. 27. What is a common cause of acute respiratory failure in critically ill patients? A. Pulmonary fibrosis. B. Rib fractures. C. Sepsis. D. Thoracic surgery. The answer is C. Sepsis. 28. Which therapeutic intervention is most appropriate for a patient with a large pleural effusion causing significant respiratory distress? A. Oxygen supplementation. B. Antibiotic therapy. C. Thoracentesis. Or D. Steroid administration. The answer is C. Thoracentesis. 29. What is the primary purpose of using inhaled nitric oxide in a patient with severe ARDS? A. To reduce airway resistance. B. To decrease pulmonary hypertension. C. To increase oxygenation. D. To promote bronchodilation. The answer is B. To decrease pulmonary hypertension. 30. When a patient is being weaned from mechanical ventilation, what is a key indicator of readiness to extubate? A. Stable blood gases for 24 hours. B. Improved muscle strength and endurance. C. Ability to clear secretions effectively. Or D. All of the above. The answer is D. All of the above. 31. Which assessment is most crucial for a patient with suspected spinal cord injury? A. Motor and sensory function. B. Bowel and bladder control. C. Skin integrity. Or D. Cranial nerve function. The answer is A. Motor and sensory function. 32. In the treatment of severe sepsis, which medication is commonly used to maintain adequate blood pressure? A. Dopamine. B. Norepinephrine. C. Dobutamine. Or D. Epinephrine. The answer is B. Norepinephrine. 33. What is the most common complication following a myocardial infarction? A. Arrhythmia. B. Heart failure. C. Stroke, D. Pericarditis. The answer is A. Arrhythmia. 34. For a patient with a Glasgow Coma Scale, GCS, score of 8 or less, what is the recommended intervention? A. Routine neurological assessments. B. Immediate intubation. C. Administration of mannitol. D. Placement in the Trendelenburg position. The answer is B. Immediate intubation. 35. Which laboratory parameter is most indicative of acute liver failure? A. Elevated liver enzymes. B. Low albumin levels. C. Prolonged prothrombin time. D. Elevated bilirubin levels. The answer is C. Prolonged prothrombin time. 36. In managing a patient with a massive transfusion, what is the primary concern? A. Hypothermia. B. Hypertension. C. Coagulopathy. Or D. Hyperkalemia. The answer is C. Coagulopathy. 37. What is the most effective intervention for preventing deep vein thrombosis, DVT, in critically ill patients? A. Early mobilization. B. High-dose anticoagulation. C. Compression stockings. D. Sequential compression devices. The answer is A. Early mobilization. In the management of a patient with diabetic ketoacidosis, what is the primary reason for administering insulin? A. To correct hyperglycemia. B. To suppress ketone production. C. To increase urine output. D. To correct electrolyte imbalances. The answer is B. To suppress ketone production. 39. For a patient with a suspected tension pneumothorax, what is the immediate intervention? A. Chest X-ray. B. Administration of oxygen. C. Needle decompression. Or D. Thoracotomy. The answer is C. Needle decompression. Number 40. In a patient with a suspected pulmonary embolism, what is the preferred diagnostic test? A. Chest X-ray. B. CT pulmonary angiography. C. Ventilation perfusion scan. Or D. Echocardiogram. The answer is B. CT pulmonary angiography. 41. What is the mainstay of treatment for a patient with an acute asthma exacerbation? A. Corticosteroids. B. Anticholinergics. C. Beta agonists. Or D. Oxygen therapy. The answer is C. Beta agonists. 42. Which factor is most strongly associated with the development of acute kidney injury in critically ill patients? A. Hypertension. B. Diabetes mellitus. C. Hypovolemia. D. Age. The answer is C. Hypovolemia. 43. What is the primary treatment for a patient with symptomatic hypoglycemia? A. Oral carbohydrates. B. Intravenous glucose. C. Subcutaneous insulin. Or D. Intramuscular glucagon. The answer is B. Intravenous glucose. 44. In a patient with septic shock, what is the target mean arterial pressure, MAP, for fluid resuscitation? A. Greater than or equal to 65 millimeters of mercury. B. Greater than or equal to 75 millimeters of mercury. C. Greater than or equal to 85 millimeters mercury. Or D. Greater than or equal to 95 millimeters of mercury. The answer is A. Greater than or equal to 65 millimeters of mercury. 45. What is the primary reason for using hypothermia in post-cardiac arrest patient? A. To reduce fever. B. To decrease brain metabolism. C. To prevent infection. Or D. To reduce blood pressure. The answer is B. To decrease brain metabolism. 46. Which symptom is most indicative of left-sided heart failure? A. Peripheral edema. B. Ascites. C. pulmonary congestion, or D, jugular vein distension? The answer is C, pulmonary congestion. 47. What is the most appropriate first step in managing a patient with suspected bacterial meningitis? A. Initiate antibiotic therapy. B. Perform a lumbar puncture. C. Administer antipyretics. Or D. Obtain a CT scan of the head. The answer is A. Initiate antibiotic therapy. 48. What is the most common early sign of a transfusion reaction? A. Hypertension. B. Fevers and chills. C. Urticaria. Or D. Tachycardia. The answer is B. Fevers and chills. 49. In a patient with acute respiratory distress syndrome, ARDS, what is the recommended strategy for mechanical ventilation? A. High tidal volumes. B. Low tidal volumes. C. High positive end expiratory pressure, BEEP. Or D. Low respiratory rate. The answer is B. Low tidal volumes. 50. For a patient experiencing an anaphylactic reaction, what is the first-line medication? A. Corticosteroids. B. Antihistamines. C. Epinephrine. Or D. Beta agonists. The answer is C. Epinephrine. 51. Which assessment finding is crucial in diagnosing a patient with a neurogenic shock? A. Tachycardia. B. Hypotension. C. Hyperthermia. Or D. Bradycardia. The answer is B. Hypotension. 52. What is the priority nursing intervention for a patient with a flail chest? A. Pain management. B. Mechanical ventilation. C. Fluid resuscitation. Or D. Chest physiotherapy. The answer is A. Pain management. 53. In a patient with suspected carbon monoxide poisoning, what is the most effective treatment? A. High-flow oxygen. B. Hyperbaric oxygen therapy. C. Mechanical ventilation. Or D. Intravenous fluids. The answer is B. Hyperbaric oxygen therapy. 54. What is the most significant risk factor for developing a hospital-acquired pressure ulcer? A. Age. B. Malnutrition. C. Immobility. Or D. Incontinence. The answer is C. Immobility. 55. In the management of a patient with status asthmaticus, what is the primary goal of treatment? A. To reduce airway inflammation. B. To correct hypoxemia. C. To reverse airway obstruction. Or D. To prevent respiratory arrest. The answer is C. To reverse airway obstruction. 56. What is the first-line treatment for a patient with acute variceal bleeding? A. Endoscopic therapy. B. Vasopressor therapy. C. Blood transfusion. Or D. Beta blocker therapy. The answer is A. Endoscopic therapy. 57. In a patient with a traumatic brain injury, which factor is most predicative of poor outcome? A. Age of the patient. B. Initial Glasgow Coma Scale score. C. Presence of hypotension. Or D. Duration of loss of consciousness. The answer is B. Initial Glasgow Coma Scale score. 58. What is the most effective strategy for preventing central line-associated bloodstream infections? A. Antibiotic lock therapy. B. Daily chlorhexidine bathing. C. Using ultrasound guidance for insertion. Or D. Strict adherence to aseptic technique. The answer is D. Strict adherence to aseptic technique. 59. Which medication is most effective for treating decompensated heart failure with pulmonary edema? A. ACE inhibitors. B. Diuretics. C. Beta blockers. Or D. Calcium channel blockers. The answer is B, diuretics. 60. In a patient with acute liver failure, which finding is indicative of hepatic encephalopathy? A. Jaundice, B. Ascites, C. Asterixis, or D. Spider angiomas? The answer is C. Asterixis. 61. What is the primary goal in the treatment of a patient with disseminated intravascular coagulation? A. Replacing coagulation factors, B. Administering anticoagulants, C. Treating the underlying cause, D. Platelet transfusion. The answer is C. Treating the underlying cause. 62. For a patient with acute renal failure, what is the most reliable indicator of fluid status? A. Urine output, B. Blood urea nitrogen, BUN, C. Serum creatinine, D. Central venous pressure, CVP. The answer is D. Central venous pressure, CVP. 63. What is the first-line treatment for a patient with hypertensive emergency? A. Oral antihypertensives, B. Intravenous beta blockers, C. Intravenous vasodilators, or D. Diuretics? The answer is C. Intravenous vasodilators. 64. In the management of a patient with acute stroke, what is the time window for administering intravenous thrombolytics? A. Within 3 hours of symptom onset, B. Within 4.5 hours of symptom onset, C. Within 6 hours of symptom onset, or D. Within 12 hours of symptom onset? The answer is B. Within 4.5 hours of symptom onset. 65. What is the primary intervention for a patient with a suspected tension pneumothorax? A. Oxygen administration, B. Chest tube insertion, C. Needle decompression, or D. Positive pressure ventilation? The answer is C. Needle decompression. 66. In the treatment of septic shock, what is the role of corticosteroids? A. First-line therapy, B. Used in refractory shock, C. Preventative treatment, or D. Used in all septic patients? The answer is B. Used in refractory shock. 67. What is the most common cause of hypoxemia in critically ill patients? A. Hypoventilation, B. Pulmonary embolism, C. Atelectasis, or D. Ventilation perfusion mismatch? The answer is D. Ventilation perfusion mismatch. 68. For a patient with an upper gastrointestinal bleed, what is the initial nursing intervention? A. Administer a proton pump inhibitor, B. Insertion of a nasogastric tube, C. Endoscopy, or D. Fluid resuscitation? The answer is D. Fluid resuscitation. 69. What is the most effective method for preventing the spread of multi-drug resistant organisms in a hospital setting? A. Hand hygiene, B. Routine use of antibiotics, C. Isolation of infected patients, or D. Regular disinfection of patient areas? The answer is A. Hand hygiene. 70. In a patient with acute myocardial infarction, what is the significance of ST segment elevation? A. Indicates a non-transmural infarction, B. Is a benign finding, C. Indicates an area of ischemia, D. Suggests a transmural infarction? The answer is D. Suggests a transmural infarction. Number 71. What is the most appropriate initial management for a patient with acute upper gastrointestinal bleeding? A. Nasogastric lavage, B. Intravenous proton pump inhibitors, C. Endoscopic evaluation, or D. Blood transfusion? The answer is B. intravenous proton pump inhibitors. 72. In the management of acute renal failure, what is the primary goal of fluid administration? A. To increase urine output. B. To correct electrolyte imbalances. C. To maintain adequate renal perfusion. D. To reduce serum creatinine levels. The answer is C. To maintain adequate renal perfusion. 73. Which ventilator mode is most commonly used for patients with acute respiratory failure who can initiate breaths? A. Volume control ventilation. B. Pressure control ventilation. C. Synchronized intermittent mandatory ventilation, SIMV. Or D. Continuous positive airway pressure, CPAP. The answer is C. Synchronized intermittent mandatory ventilation, SIMV. 74. What is the first-line treatment for symptomatic bradycardia in a hemodynamically unstable patient? A. Atropine. B. Pacemaker. C. Epinephrine. D. Dopamine. The answer is A. Atropine. 75. In the management of a patient with diabetic ketoacidosis, what is the importance of potassium replacement? A. To prevent arrhythmias. B. To correct acidosis. C. To enhance insulin effectiveness. D. To increase urine output. The answer is A. To prevent arrhythmias. 76. Which sign or symptom is most indicative of left-sided heart failure? A. Peripheral edema. B. Jugular venous distension. C. Orthopnea. D. Hypomegaly. The answer is C. Orthopnea. 77. What is the primary goal in the management of a patient with septic shock? A. To reduce fever. B. To maintain adequate tissue perfusion. C. To normalize white blood cell count. D. To eradicate the infection. The answer is B. To maintain adequate tissue perfusion. 78. In a patient with a suspected acute coronary syndrome, what is the significance of elevated troponin levels? A. Indicates stable angina. B. Is a normal finding. C. Suggests myocardial injury. Or D. Indicates pericarditis. The answer is C. Suggests myocardial injury. 79. What is the most effective strategy for preventing ventilator-associated lung injury in ARDS? A. High tidal volume ventilation. B. Low tidal volume ventilation. C. High frequency oscillatory ventilation. Or D. Prone positioning. The answer is B. Low tidal volume ventilation. 80. For a patient with acute pulmonary embolism, what is the primary treatment? A. Thrombolytic therapy. B. Anticoagulation. C. Surgical embolectomy. Or D. Oxygen therapy. The answer is B. Anticoagulation. 81. What is the first-line medication for acute rate control in atrial fibrillation? A. Amiodarone. B. Digoxin. C. Diltiazem. Or D. Metoprolol. The answer is C. Diltiazem. 82. In a patient with a traumatic brain injury, what is the most important factor to monitor to prevent secondary injury? A. Serum glucose levels. B. Intracranial pressure. C. Oxygen saturation. Or D. Blood pressure. The answer is B. Intracranial pressure. 83. What is the primary indication for initiating renal replacement therapy in a patient with acute kidney injury? A. Hypertension. B. Oliguria. C. Hyperkalemia. D. Elevated BUN. The answer is C. Hyperkalemia. 84. In the treatment of a patient with severe sepsis, what is the role of activated protein C? A. To reduce inflammation. B. to improve microcirculation, C. to decrease coagulation, D. to enhance antibiotic effectiveness. The answer is C. to decrease coagulation. 85. What is the most appropriate initial step in managing a patient with a suspected spinal cord injury? A. Administration of corticosteroids. B. Immediate surgery. C. Spinal immobilization. D. High-dose diuretics. The answer is C. Spinal immobilization. 86. For a patient with a suspected tension pneumothorax, what is the immediate intervention? A. Chest X-ray. B. Oxygen administration. C. Needle decompression. D. Positive pressure ventilation. The answer is C. Needle decompression. 87. What is the primary treatment for a patient with acute exacerbation of chronic obstructive pulmonary disease, COPD? A. Antibiotics. B. Corticosteroids. C. Oxygen therapy. D. Beta agonists. The answer is B. Corticosteroids. 88. In a patient with acute liver failure, what is the primary concern regarding brain function? A. Cerebral edema. B. Seizures. C. Stroke. D. Encephalopathy. The answer is A. Cerebral edema. 89. What is the first-line treatment for a patient with symptomatic hypoglycemia? A. Oral glucose. B. Intravenous dextrose. C. Glucagon injection. D. Complex carbohydrates. The answer is B. Intravenous dextrose. 90. In the management of a patient with a massive pulmonary embolism, what is the primary intervention? A. Anticoagulant therapy. B. Thrombolytic therapy. C. Surgical embolectomy. D. Oxygen supplementation. The answer is B. Thrombolytic therapy. 91. What is the recommended treatment for a patient with a burn injury and inhalation trauma? A. High-flow oxygen. B. Corticosteroids. C. Escherotomy. D. Mechanical ventilation with PEEP. The answer is D. Mechanical ventilation with PEEP. 92. In a patient with acute decompensated heart failure, what is the primary reason for administering diuretics? A. To decrease blood pressure. B. To improve renal function. C. To reduce pulmonary congestion. D. To correct electrolyte imbalances. The answer is C. To reduce pulmonary congestion. 93. For a patient with suspected meningitis, what is the most important diagnostic test? A. Blood cultures. B. CT scan of the head. C. Lumbar puncture. D. EEG. The answer is C. Lumbar puncture. 94. What is the primary goal of using vasopressors in the treatment of shock? A. To increase cardiac output. B. To reduce heart rate. C. To improve tissue perfusion. D. To decrease preload. The answer is C. To improve tissue perfusion. 95. In a patient with acute pancreatitis, what is the best indicator of disease severity? A. Serum amylase levels. B. Serum lipase levels. C. Ranson's criteria. Or D. Abdominal ultrasound findings. The answer is C. Ranson's criteria. 96. What is the most common cause of acute kidney injury in hospitalized patients? A. Nephrotoxic medications. B. Glomerulonephritis. C. Urinary tract obstruction. Or D. Prerenal azotemia. The answer is D. Prerenal azotemia. 97. What is the initial management for a patient with an acute ischemic stroke and elevated blood pressure? A. Immediate antihypertensive therapy. B. Thrombolytic therapy. C. Delayed blood pressure management, D. Intravenous fluids. The answer is A. Immediate antihypertensive therapy. 98. In the care of a patient with ARDS, what is the rationale for using prone positioning? A. To reduce the work of breathing. B. To improve ventilation perfusion matching. C. To prevent ventilator-associated pneumonia. Or D. To increase lung compliance. The answer is B. To improve ventilation perfusion matching. 99. What is the primary concern in the first hour of treating a patient with septic shock? A. Antibiotic administration. B. Fluid resuscitation. C. Blood culture collection. D. Vasopressor initiation. The answer is B. Fluid resuscitation. 100. In a patient with diabetic ketoacidosis, what is the primary goal of fluid therapy? A. To correct electrolyte imbalances. B. To improve renal function. C. To restore intravascular volume. Or D. To reduce blood glucose levels. The answer is C. To restore intravascular volume. Number 101. What is the most appropriate treatment for a patient with a tension pneumothorax? A. Oxygen therapy. B. Needle decompression. C. Chest tube insertion. D. Positive pressure ventilation. The answer is B. Needle decompression. 102. For a patient with an acute myocardial infarction, why is early reperfusion therapy important? A. To prevent heart failure. B. To reduce the size of the infarct. C. To lower blood pressure. Or D. To control arrhythmias. The answer is B. To reduce the size of the infarct. 103. In a patient with acute liver failure, what is the most important factor in preventing further liver damage? A. Nutritional support. B. Avoidance of hepatotoxic drugs. C. Blood transfusions. Or D. Liver transplant. The answer is B. Avoidance of hepatotoxic drugs. 104. What is the primary goal in managing a patient with hypovolemic shock? A. Vasopressor administration. B. Rapid fluid resuscitation. C. Hemostasis. Or D. Oxygen supplementation. The answer is B. Rapid fluid resuscitation. 105. In a patient with a subarachnoid hemorrhage, what is the primary concern during the acute phase? A. Seizures. B. Rebleeding. C. Vasospasm. Or D. Hydrocephalus. The answer is B. Rebleeding. 106. What is the most effective strategy for reducing the risk of catheter-related bloodstream infections? A. Routine replacement of central venous catheters. B. Use of antibiotic-impregnated catheters. C. Strict aseptic technique during insertion and care. Or D. Frequent dressing changes. The answer is C. Strict aseptic technique during insertion and care. 107. In the management of a patient with anaphylaxis, what is the role of corticosteroids? A. First-line treatment. B. Used to prevent late-phase reactions. C. Used as a substitute for epinephrine. Or D. Used to treat hypotension. The answer is B. Used to prevent late-phase reactions. Number 108. For a patient with a massive hemoptysis, what is the initial management? A. Bronchoscopy. B. Mechanical ventilation. C. Lateral decubitus positioning. Or D. Intravenous antibiotics. The answer is C. Lateral decubitus positioning. 109. What is the primary goal of sedation in mechanically ventilated patients? A. To prevent ventilator-associated lung injury. B. To ensure patient ventilator synchrony. C. To reduce anxiety and discomfort, or D. To facilitate weaning from mechanical ventilation? The answer is B. To ensure patient ventilator synchrony. 110. In a patient with acute respiratory failure, what is the indication for non-invasive ventilation? A. To treat hypercapnic respiratory failure. B. As a first-line treatment for ARDS. C. To manage hypoxemic respiratory failure. Or D. To avoid intubation in patients with DNR orders. The answer is A. To treat hypercapnic respiratory failure. 111. What is the primary nursing intervention for a patient experiencing acute chest pain suspected to be a myocardial infarction? A. Administration of aspirin. B. Immediate angioplasty. C. High-flow oxygen therapy. Or D. Intravenous nitroglycerin. The answer is A. Administration of aspirin. 112. In a patient with severe sepsis, what is the significance of lactate levels in guiding resuscitation efforts? A. High levels indicate effective resuscitation. B. They are unrelated to sepsis severity. C. High levels indicate inadequate tissue perfusion. D. They determine the need for antibiotic therapy. The answer is C. High levels indicate inadequate tissue perfusion. 113. What is the most appropriate intervention for a patient with a suspected opioid overdose? A. Gastric lavage. B. Administration of naloxone. C. High-flow oxygen. D. Fluid resuscitation. The answer is B. Administration of naloxone. 114. In a patient with a suspected acute aortic dissection, what is the first-line imaging study? A. Chest X-ray. B. Transthoracic echocardiogram. C. CT scan with contrast. D. MRI of the chest. The answer is C. CT scan with contrast. 115. What is the primary goal in the management of a patient with a massive hemoptysis? A. To control bleeding. B. To maintain airway patency. C. To prevent infection. Or D. To administer antibiotics. The answer is B. To maintain airway patency. 116. For a patient with acute renal failure and hyperkalemia, what is the most immediate treatment? A. Hemodialysis. B. Calcium gluconate administration. C. Sodium bicarbonate infusion. Or D. Insulin and glucose administration. The answer is B. Calcium gluconate administration. 117. In a patient with acute respiratory distress syndrome, ARDS, what is the rationale for using a low tidal volume ventilation strategy? A. To increase oxygenation. B. To reduce the risk of ventilator-induced lung injury. C. To decrease carbon dioxide levels. Or D. To increase lung compliance. The answer is B. To reduce the risk of ventilator-induced lung injury. 118. What is the first-line pharmacological treatment for a patient with acute mania? A. Antidepressants. B. Antipsychotics. C. Mood stabilizers. Or D. Benzodiazepines. The answer is C. Mood stabilizers. 119. In the management of a patient with a heat stroke, what is the most important initial intervention? A. Antipyretics administration. B. Rapid cooling. C. Intravenous fluid resuscitation. Or D. Electrolyte correction. The answer is B. Rapid cooling. 120. What is the primary indication for the use of inotropic agents in the treatment of heart failure? A. To reduce preload. B. To control heart rate. C. To improve cardiac contractility. Or D. To decrease afterload. The answer is C. To improve cardiac contractility. Number 121. In a patient with a suspected pulmonary embolism, what is the role of D-dimer testing? A. It is diagnostic for pulmonary embolism. B. It is used to assess the severity of embolism. C. It is used as a screening tool to rule out pulmonary embolism. D. It is used to monitor treatment response. The answer is C. It is used as a screening tool to rule out pulmonary embolism. 122. What is the most effective strategy for preventing hospital-acquired pneumonia in ventilated patients? A. Routine antibiotic prophylaxis. B. Sterile suctioning techniques. C. Semi-recumbent positioning. Or D. Daily oral care with chlorhexidine. The answer is D. Daily oral care with chlorhexidine. 123. In a patient with severe acute pancreatitis, what is the most common complication? A. Pancreatic pseudocyst. B. Hemorrhage. C. Infection. Or D. Diabetic ketoacidosis. The answer is C. Infection. 124. For a patient with a suspected stroke, what is the primary reason for a rapid assessment and treatment? A. To prevent secondary stroke. B. To improve the chances of recovery. C. To alleviate symptoms. Or D. To prevent long-term disability. The answer is B. To improve the chances of recovery. 125. What is the primary intervention for a patient with a suspected tension pneumothorax and hemodynamic instability? A. Chest X-ray. B. Immediate needle decompression. C. Oxygen administration. D. Fluid resuscitation. The answer is B. Immediate needle decompression. 126. In a patient with acute liver failure, what is the primary management strategy to prevent cerebral edema? A. High-dose corticosteroids. B. Hyperventilation. C. Mannitol administration. D. Restriction of fluid intake. The answer is C. Mannitol administration. Number 127. What is the most common early complication following a major surgical procedure? A. Infection. B. Thromboembolism. C. Acute renal failure. Or D. Atelectasis. The answer is D. Atelectasis. 128. In a patient with a burn injury, what is the primary goal of fluid resuscitation in the first 24 hours? A. To maintain urine output. B. To prevent hypothermia. C. To stabilize hemodynamics. Or D. To correct electrolyte imbalances. The answer is C. To stabilize hemodynamics. 129. What is the primary indication for the use of continuous renal replacement therapy, CRRT, in critically ill patients? A. Severe hyperkalemia. B. Fluid overdose unresponsive to diuretics. C. Acute glomerulonephritis. Or D. Chronic renal failure. The answer is B. Fluid overload unresponsive to diuretics. Number 130. In a patient with an acute ischemic stroke, what is the primary goal of early thrombolytic therapy? A. To prevent further clot formation. B. To reduce the risk of hemorrhagic transformation. C. To restore blood flow to the affected area of the brain. Or D. To lower blood pressure. The answer is C. To restore blood flow to the affected area of the brain. 131. In a patient with a severe head injury, what is the primary goal of managing intracranial pressure? A. To maintain a cerebral perfusion pressure above 60 millimeters mercury. B. To reduce cerebral blood flow. C. To ensure normocapnia. Or D. To prevent seizures. The answer is A. To maintain a cerebral perfusion pressure above 60 millimeters mercury. Number 132. What is the initial management for a patient with a suspected toxic ingestion? A. Gastric lavage. B. Activated charcoal administration. C. Immediate intubation. Or D. Intravenous fluid resuscitation. The answer is B. Activated charcoal administration. 133. In a patient with acute respiratory failure, what is the primary indication for intubation and mechanical ventilation? A. Hypoxemia, that is unresponsive to supplemental oxygen. B. Respiratory rate above 30 breaths per minute. C. Presence of bilateral infiltrates on chest X-ray. Or D. Acidosis with a pH less than 7.25. The answer is A. Hypoxemia that is unresponsive to supplemental oxygen. 134. What is the most appropriate intervention for a patient with acute variceal hemorrhage? A. Endoscopic band ligation. B. Sclerotherapy. C. Systematic antibiotics. Or D. Vasopressor therapy. The answer is A. Endoscopic band ligation. 135. In the management of a patient with a cardiogenic shock, what is the primary purpose of interaortic balloon pump, IABP, insertion? A. To reduce afterload. B. To increase preload. C. To improve coronary artery perfusion. Or D. To stabilize heart rhythm. The answer is A. To reduce afterload. 136. What is the primary indication for the administration of hypertonic saline in a patient with traumatic brain injury? A. To control seizures. B. To reduce intracranial pressure. C. To correct hyponatremia. Or D. To improve cerebral perfusion. The answer is B. To reduce intracranial pressure. 137. In a patient with acute pancreatitis, what is the most common cause of early mortality? A. Infection. B. Hemorrhage. C. Organ failure. Or D. Pseudocyst formation. The answer is C. Organ failure. 138. For a patient with a suspected myocardial infarction and contraindications to thrombolytics, what is the preferred treatment? A. Coronary artery bypass grafting. B. Percutaneous coronary intervention. C. High-dose statin therapy. Or D. Long-term anticoagulation. The answer is B. Percutaneous coronary intervention. 139. What is the primary treatment for a patient with an acute exacerbation of ulcerative colitis? A. Antibiotics. B. Surgical intervention. C. Corticosteroids. D. Probiotics. The answer is C. Corticosteroids. 140. In a patient with acute respiratory distress syndrome, ARDS, what is the significance of the PaO2/FiO2 ratio? A. It determines the need for mechanical ventilation. B. It is used to assess the severity of ARDS. C. It guides the choice of ventilator settings. Or D. It indicates the presence of a shunt. The answer is B. It is used to assess the severity of the ARDS. 141. What is the primary goal in the management of a patient with neurogenic shock? A. To control pain. B. To maintain adequate blood pressure. C. To prevent deep vein thrombosis. Or D. To enhance neurologic recovery. The answer is B. To maintain adequate blood pressure. 142. In a patient with acute liver failure, what is the most important factor in assessing prognosis? A. Serum bilirubin levels. B. Degree of encephalopathy. C. INR, International Normalized Ratio. Or D. Liver biopsy findings. The answer is C. INR, International Normalized Ratio. 143. For a patient with suspected bacterial meningitis, what is the importance of early antibiotic administration? A. It reduces the risk of complications. B. It decreases the duration of symptoms. C. It prevents the spread of infection to contacts. Or D. It reduces the risk of long-term neurological damage. The answer is A. It reduces risk of complications. 144. What is the most effective strategy for preventing deep vein thrombosis in immobilized patients? A. Early mobilization. B. Sequential compression devices. C. Low molecular weight heparin. D. Warfarin. The answer is C. Low molecular weight heparin. 145. In a patient with a severe asthma exacerbation, what is the primary goal of bronchodilator therapy? A. To reduce inflammation. B. To improve oxygenation. C. To relieve bronchospasm. Or D. To prevent respiratory failure. The answer is C. To relieve bronchospasm. 146. What is the primary consideration in the selection of a vasopressor agent for the treatment of septic shock? A. The patient's heart rate. B. The presence of arrhythmias. C. The patient's blood pressure. Or D. The underlying cause of sepsis. The answer is C. The patient's blood pressure. 147. In a patient with acute kidney injury, what is the significance of oliguria? A. It is a definitive sign of renal failure. B. It indicates a pre-renal cause. It is an indication for immediate dialysis. Or D. It suggests a poor prognosis. The answer is B. It indicates a pre-renal cause. 148. What is the primary rationale for the use of sedation holidays in mechanically ventilated patients? A. To assess the patient's neurological status. B. To reduce the risk of ventilator-associated pneumonia. C. To facilitate weaning from the ventilator. Or D. To prevent drug dependence. The answer is A. To assess the patient's neurological status. 149. In the management of a patient with a pulmonary embolism, what is the role of echocardiography? A. To confirm diagnosis. B. To assess the right ventricular function. C. To evaluate for deep vein thrombosis. Or D. To guide thrombolytic therapy. The answer is B. To assess the right ventricular function. 150. For a patient with acute hypoxemic respiratory failure, what is the primary indication for high-flow nasal cannula therapy? A. To deliver high concentrations of oxygen. B. To provide positive airway pressure. C. To reduce the work of breathing. Or D. To promote carbon dioxide elimination. The answer is A. To deliver high concentrations of oxygen.